Are we live? Hi, everybody. So good to be back with you on our Friday Facebook Live. Feels like it's been a really long time. I know it's only been a couple of weeks, and I hope these last couple of weeks have been healthy and restful for all of you. We've got a couple of things that I want to share with you today. And I always like to share some good news. And we do have some good news, even though I know that right now is still a tenuous time for lots of us. And those of you that have been coming into clinic and we've been taking care of you in clinic, there's still obviously a tremendous amount of concern about COVID-19. And there's been some change. Some things have changed and some things it seems like haven't really changed. So I don't want to spend a lot of time talking about it because I think, there's a lot of talk that's there's a lot of other people talking about COVID-19, but as a medical provider, as a physician, as your physician, I wanted to give you at least a couple of updates. There are all kinds of different predictions about what we can expect over the next 6 months and even the next 12 to 18 months when it comes to this virus. There are still vaccines that are in development. If that's something that's going to be interesting for you, we'll try to stay ahead of that as well. The testing is a lot more prevalent now. There's some rapid testing that's available. There's still the nasal swab that is available. The rapid test means that you get a result in about 15 minutes. It's still probably not as accurate as we'd like it to be, but excuse me. But it's, certainly if you're having symptoms at all, and you're getting, then you should be tested. There's plenty of testing facilities that are available now. And we still have the blood test that is sent to a lab. Results come back in 24 to 48 hours, and it's FDA approved and very accurate in the high 90s for IgM, which is the acute phase antibody, and IgG, which is the one that we look for longer term conferred immunity. And there's still a lot we're learning about this virus, but here's some good news. The good news is that there's been more research that's been done about the benefits of some more holistic options, such as vitamin D3. Vitamin D3 is pretty well represented in the literature that's just been in the last few months on how it can help you. And if you'll remember our immune package, I'm gonna just refresh your memory a little bit about what that immune package was. There in that Daily 2, there's a nice full dose of vitamin D3 as well as a whole complete multivitamin. And our own little thymosin alpha, our fantastic peptide, our thymosin alpha 1 peptide. Just recently, in the last month, there was a very nice research article that came out touting the benefits specific, not just for all viruses, but specifically for COVID-19 with thymosin alpha 1. And I think the focus of that study was actually on healthcare workers who are in an unfortunate situation of lots of exposure. So our little thymosin alpha 1 is just showing to be a fantastic supplement for your immune system. It has all those other benefits that we've talked about. So don't be afraid. Let's keep moving forward. We're going to keep our immune system strong. The recommendation is still obviously to be, social distancing, washing your hands a lot. I know that doesn't get as much press as other things do, but the soap and water breaks down that viral envelope. So you want to wash your hands a lot, and then wearing masks to protect yourself and to protect others that could be in the vicinity if you did have a sneeze or a cough or something like that. And here we're still open for business. Most physician offices are open. We're practicing social distancing the best that we can, and we are all wearing masks, and we ask everybody who comes in to wear a mask. And we finally have a little bit more access to what's called PPE now. That's the personal protective equipment or supplies that was in terrible short supply because we all needed it all at the same time. That's so far we've been able to have more access to that, which has been really good. So I'm just going to remind you, because we're still in a state of trying to keep our immune system as robust as we possibly can. I'm just going to remind you of what that immune boost package, it's still available. And certainly if you've done we've had several people who've done the immune boost package who wanted to continue with IV therapy or wanted to continue with one of the components. And of course, we're here to serve you in that way as well. And if you'd like to continue being able to use that thymosin alpha, if you'd like to become a peptide patient of mine and you live in Florida, you're more than welcome to do that as well, so that you can have ongoing access to the thymosin alpha 1 peptide. Let me just show you quick, and then we're going to move on and talk about some other things. I'm going to come over here. So this is the immune boost package. You have, this is what's included. You get one IV in a liter of saline, which is a nice hydrating liter of saline with high dose vitamin C and extra doses of all of the B vitamins. You're going to get one injection while in clinic of the thymosin alpha 1, and this is a loading dose injection. It's a 6,000 microgram injection. Then in the supplements goodie bag, this is the Biocidin throat spray, which there's all the literature that I had shared. I don't want to, I know you guys have all heard everything all about these supplements and why I chose them for the immune boost package. This is what I've been using. This is what my family has been using, and we have been able to stay healthy, and we want everybody to be able to stay healthy. We've got the either liposomal vitamin C, or I also have the capsules or the tablets that are the higher dose vitamin C, orally as tolerated. Not everybody can tolerate higher doses. It can cause some stomach upset for a lot of folks, but we still want to have that vitamin C on board. That's really, really an excellent thing to help your immune system. The colloidal silver. The Daily 2, which is a multivitamin, that's where I mentioned we've got that full dose of vitamin D3, not the 400 international units, the full dose, the 2,000, 4,000 international units of vitamin D3, and the zinc. We either have the lozenges, and we also have the zinc picolinate, which is the capsules. We have those too. And then, of course, if you get a family package, we have either for one person or for a couple or for family, we're going to throw in a K-laser lung treatment, one of the K-laser treatments while you're here. And so this is what the packages look like, and I'm not going to spend a lot of time on this. I'll show you how to get to that if you're interested in that or in any component of the package. That's 2 people for 1 month, meaning you get one IV, 1 dose of the thymosin alpha, and then you also get 1 month of the goodie bag. But we also there were a lot of folks who wanted more than 1 month of the goodie bag supplements, which were significantly discounted to be able to put them in a package for you all. If you remember, I was telling you about that. Then we can always do that for you as well. And so this is that's where you go if you are interested in the immune boost package. And if you're interested in any of the information on those ingredients, and if you don't live nearby, that you could come to see us so that I can help you wherever you are. If you wanted to take that information to your local physician and see if they might be able to accommodate you, these are all good, just things that are going to really help your immune system. And that's what's going to hopefully, if you did come in contact with this virus or any other virus, can make it a mild, short-lived event rather than, this terrible thing that some people have had to go through and certainly have lost their life. Some people have lost their life with this. So just as a reminder, we're still keeping that immune system strong, and I still do have that available if you're interested in that. Now, let's go back to talking about something that's not COVID related. So I'm sure all of you are feeling the same way that I am, that this is not how we thought our summer was going to be. And we're out of our routine, very out of our routine, and trying to just put some semblance of routine and regularity and maybe healthy habits that kind of got thrown by the wayside. Almost all of us are in that position. Very few of us have actually said, oh my gosh, I'm actually healthier and eating better and doing all the things I'm supposed to do while in this isolation or quarantine, or even if we're not as quarantined as we were, we're still not doing a lot of the things outside of our home that we otherwise would be doing. A lot of us that live, especially in Florida, we maybe, use the beach during the summertime. Kids are out of school, and it's certainly a little different than what it's been in the past. And I've been dealing with that too, trying to find those healthy alternatives, trying to get back into some new normal, new routine that keeps my immune system healthy and my whole body healthy. Maybe some of you have put on a couple of unwanted pounds during this period of time. I know that's a very, very common thing that's happening. And so we had been thinking about doing something for summer, and we're a little bit later in starting this than we normally would have been, but the timing I think is right, considering everything else that's really taken precedent and been more important for most of us. But now I'd like to at least offer you some ways of trying to get back into that healthy routine with summer. So we've put together some summer packages, and these are basically, there's an introductory level package, and I'll show you that in a minute, that has to do with options of trying to get things back together. If you're trying to, wanting to get back into a bathing suit and maybe your body's not looking like how you'd like it to, or you'd like to do a refresh and try to do some aesthetic things to just get that younger, refreshed look, we put the whole thing back together. And if you're interested in trying to get some of those unwanted pounds back off, there's a whole program for that as well. So let me show you what we've done. And you might have noticed that my skin is a little bit darker than the last time you saw me. I have been using the melanotan peptide. I'm going to continue to use it. This is a peptide that I use every summer because I'm very, very fair. I'm at great risk for skin cancer and sun damage to my skin and sunburns. And even with wearing sunscreen, as you know, I like to keep a hat on and try to stay covered because the sunscreen, there's a lot of reasons that sunscreen is not always doing the trick. That it washes off, it sweats off. There's maybe people, don't do well with certain things on their skin, and trying to stay covered all summer is not as easy as one might think, especially if you live in South Florida. But the melanotan peptide is a fantastic alternative. It's an injectable peptide, and it works on more than just to make you tan. But the melanocortin system in the brain is a very complicated system, and it's related to the quality of sleep, it's related to libido, it's related to inflammation, and the melanin that your body produces more melanin when you actually stimulate that and use that peptide. That's where you see the coloration changes. So you will probably continue to see me get a little bit darker than what I am right now. This is not going out in the sun. I haven't been out in the sun at all. This is preparing my skin, and I'm getting all the benefits of better sleep. And there actually is a weight loss component to melanotan that's independent of all the other things. I'm not sure. I haven't gotten on the scale. I'm going to do this summer package with you. So I'm going to start by doing my body composition analysis either today or early next week, and we're going to see where we're starting from. And I'll talk to you about the different individual things that are offered in the packages. And again, if you don't live near me, but these are things that you say, you know what, I think that's something that would be good for me, that would help break me out of the routine that I'm in, then I'm sure you'll be able to find doctors that offer these kinds of services that are near you. And at least you know a little bit more about some of these things. And of course, in one of the packages, in two of the packages, we're going to be adding more peptides because I love peptides. So let me show you what we have, and then I'm going to talk a little bit more specifically about one of the services, just so you can learn a little bit more about it, that we put in the package. So I'm going to go back over. Here we go. So here is the packages. No. Oh, I'm sorry. Not yet. There we go. Okay. So here's the packages. And this is our Jumpstart Your Summer package. And this is going to include one vampire facelift. And that's one of the things I'm going to talk a little bit more about. If you live anywhere near me, please come, and I'd love to do this procedure for you. If you don't, we've got a whole network of physicians that are around the country that are trained and certified to do that procedure. We have an Exilus treatment. The Exilus is a skin tightening piece of technology. It's a machine, and what we are able to do with the Exilus is there's a couple settings. There's a setting that does some targeted fat burning while tightening the skin, and then there's the main settings that people use on the neck, underneath the chin, on the face, that is all about using radio frequency combined with ultrasound to tighten skin, to just give it that fresher, younger look. Then an in-body, this is a body composition analysis. So if you just get on a scale, which lots of us don't really enjoy getting on the scale, but just getting on the scale doesn't really tell us everything to help you transform not just the way you look, but what's going on inside your body. And a body composition analysis actually shows how much muscle, it shows the percent body fat, it shows the percent body muscle. So it shows even in regions of the body. So it'll do upper extremity, trunk, lower extremity, and it'll also show you what your intracellular and extracellular body water are, because water status is really important. Sometimes people think that they've gained weight when really they're either retaining water and then we have to adjust some things, or their water composition is really low and we need to hydrate them better. Your metabolism doesn't run if you are volume down. If you're dehydrated, your metabolism can't run efficiently. It requires water to do that. So this is included in the package. So you get the one in the beginning, and then we're going to get one done at the end as well. It's really neat. I'll show you in a subsequent Facebook Live. I'm going to show you what the actual report looks like and how much you actually get to learn your basal metabolic rate. So how many calories are you burning just sitting here? Not just when you're exercising or doing something active, but what is your energy needs from your food while you're just sitting. And as you may know, the more muscle mass you have, the more your body burns efficiently, and the more calories you burn, more food you're burning off by not even doing activity. We're also going to give you a fitness consult with Erin Bryant. She is an absolute professional. She has a master's degree in exercise physiology and a tremendous amount of experience. She has agreed to partner with us because, just sending you on your way to try to exercise. I mean, I know so many patients who have been injured doing that. They don't have direction. It's not very motivating. And that's not what I want for you. I want you to be able to have an analysis. And if you may have some limitations, such as knee problems, back problems, things that you're concerned about, that you could have a fitness program developed around that and still get excellent results without putting your joints or any other body part at risk for injury or getting worse if you have some kind of limitation. She's very, very skilled, which is a really unique skill to be able to successfully work around that and still get you the result that you're looking for. And so we're also, even in the introductory package, I want you to have access to this tanning peptide for all of the benefits that it provides. And not everybody, there's going to be some people that may not be a candidate for the melanotan, and I'll make sure to substitute something else for you if you're not a candidate for it. But you can see for yourself. I think I've got a picture of my before melanotan, and I'm only about halfway through the initial process of what you do is you use it every day until you get to that kind of either the desired coloration if you're looking for tanning, or the sleep, or the increased libido, where you kind of reach where you'd like to be. And then there's a maintenance that's just twice a week ongoing until you're done with the peptide. I don't use it year round, but I have lots of physicians that I know who do. So now this is the middle package, and I know this is a big difference in price, but we're actually doing a whole bunch more here. This is where you're going to get full sessions of the skin tightening plus the M-Sculpt. The M-Sculpt sessions, so the M-Sculpt is a machine that we'll go into in greater detail a little bit down the road. What I really want to talk about today is the Vampire Facelift, because that's going to be in all of these packages. And these are available for you to look at as you wish, and I'll tell you what the link is for that at the very end. But this is what we're trying to give you, a whole variety of things where that might be able to just packages that can get you out of the funk of quarantine and isolation and try to start a new normal that has you in a healthier state and just more energetic, stronger, healthier, and feeling better. So let's talk a little bit about the Vampire Facelift. And I actually did a video on this, and I'm going to go ahead and play the video, and then I'm going to talk to you a little bit more about it. If you're wondering, I do the Vampire Facelift to my own face, and I do it about once a year. But the results for the Vampire Facelift do last anywhere from 12 to 18 months, for some people even longer than that. So let's go here to the video. I'm going to play it for you, and then we'll talk a little bit more about it. Hey, Dr. Heather here, and in this video today, I would like to talk to you about the Vampire Facelift. Yes, Vampire Facelift. Now, for those of you who have never heard the term vampire referring to a medical procedure, I can tell you that
Where it comes from Dr. Charles Runnels, who's the inventor and perfecter of the vampire facelift. Vampire refers to us drawing your blood, just like a vampire would. And that's what we do. We draw your blood, we isolate out your platelets, we create the platelet-rich plasma, which is your own fantastic growth factor matrix in your blood, and we reintroduce that into the face in a very specific place, very specific fashion. So how did this ever come to be? Well, Dr. Runnels initially did a lot of research on what we already knew about platelet-rich plasma. What can it do? What are all of the amazing rejuvenative healing properties that it has? And what Dr. Runnels found when using PRP in the face were 6 main big benefits. 1, there's never been an allergic reaction or necrosis. This substance is coming from your own body, so the body does not react to it as a foreign substance. 2, bruising is minimal, if at all. 3, there is no lumpiness or nodules. 4, the effects last at least 18 months and could be permanent, as if the skin actually became younger. 5, there's actual growth of new tissue by stimulation of the unipotent stem cells. So the change in shape is not from something foreign being in the body, but from the body actually rejuvenating and growing. 6, the PRFM, or platelet-rich fibrin matrix, stimulates new blood flow with new vessels, also called neovascularization, not from just dilatation of the existing blood vessels. So the vampire facelift is an amazing alternative to surgery, certainly, and can provide a youthful, long-lasting, beautiful look with improved skin color and tone, as well as lifting the face. The vampire facelift is not for everybody, so I developed a little survey that can...
The survey is not quite ready yet, so we will have that ready, though. We're going to give you the link for it. And if you're interested, and I'll kind of tell you the kinds of things that we're really looking for, because with the surveys, what I like to do is to just give you an idea of if you feel like you're a candidate for this, because not everybody is. And I'll go through that a little bit more at the end here. But just wanted to make sure you knew we're getting the survey together for you. Don't have it just done just yet.
And help you decide if the vampire facelift is for you. You can take the survey by clicking the link below or pushing the button, or you can go to drheather.net/facelift survey. drheather.net/facelift survey. Thank you for taking the time with us today. We are just trying to help you have your best life ever.
Okay. Okay, so you can see me. Let's see, what did I do here? Okay. Okay, so that's a little video that I had done actually quite some time ago about the vampire facelift. So really, the vampire facelift is for almost everybody, but if you're looking for a surgical facelift, it's not going to replace a surgical facelift. People are often looking for the same results as a surgical facelift with a non-surgical option. And we have a lot of options, but if you have a lot of loose extra skin and what you're really looking to do is to have that surgically removed, then that's a surgical facelift. That's not this. But if you're looking to give that very natural looking, youthful look. So a lot of people that will come to me for aesthetics, they will say, I don't want to walk out and look like a different person. I don't want it to be a lot of, that I see somebody and they say, oh my gosh, you had this and this and this and this and this done to your face. They want it to be just a gentle, subtle, natural transformation that isn't quite so noticeable. More like, oh, did you get a different hairstyle? Or gosh, that color, that outfit looks really great on you. Or, something where they're noticing that you're looking fresher, younger, but not quite so obvious as to why that is. A lot of people that's what they're looking for. And for men, the vampire facelift is for men as well. This is a very, it's so natural and it's so available for just about everybody. Now, every face is going to be custom. It's not a one size fits all, but we're using PRP. We're using that combined with Juvederm or Voluma. Usually it's Juvederm, which is a FDA approved hyaluronic acid filler made by Allergan and very, very well tested. And it's how it's used, it's where it's put. You're going to get that lift. You're also going to get the improved collagen and coloration of the skin from the PRP. And interestingly, the PRP and hyaluronic acid together, the hyaluronic acid will actually activate the PRP, which makes it stay in tissues a lot longer. And the PRP will give that hyaluronic acid a much longer lifespan. So you don't have to repeat it near as frequently as if you're using HA by itself. So Vampire Facelift is done a little bit differently for men than it is for women because women don't want to be masculinized and men don't want to be feminized. There are different ways of utilizing that technology depending on the masculine and feminine face. But it's such a fantastic procedure. Everybody walks out, they can see the results right away, and the results just get better and better over the course of about 4 weeks as everything really activates and starts to settle in. And it's a really nice way to walk in and walk out with an updated, youthful, uplifted look, and to get that summer going a little bit better. So I think that's it for today. I hope that this was helpful for you. We'll talk about some of these other things as well. And of course, IV therapy in general. Remember that we have to stay hydrated. It's really hot in the summertime, especially in South Florida. So even if you're just looking to get IV hydration, that's going to help your skin, it's going to help your joints, and it's going to help your whole system. You don't want to be dehydrated. Your system doesn't work. Your cells don't work that well when the water content is low. So keep that in mind too, that stay hydrated, and I'm going to go ahead and give you the summer package link so that you can look at it for yourself, peruse it, look at the different items, and we will talk about some of these things in more detail in upcoming live streams. But it's so nice to reconnect with you. I hope that everybody is doing well and is excited to kind of change the focus just a little bit to try to finish out our summer with a bang. Until next time, I will see you next Friday. Take care.